Finding out that this virus is now transmitting before people see signs. So what we've been telling people from directives from the CDC for weeks now, that if you start feeling bad, stay home. Those individuals could have been infecting people before they ever felt bad. Well, we didn't know that until the last 24 hours. And as Dr. Toomey told me, she goes, this is a game changer for us. And I had been listening to her advice. I think the other measures that we've taken previously, if you would look at our order and the things that we did, ordering every business to adhere to strict social distancing guidelines, shelter in place for the elderly and or the medically fragile, and putting a ban on the large gatherings. If you compare that to other states that had shelter in place but had all kind of exemptions and exceptions and essential businesses, we had as strong an order as anybody in the country. I think the issue is we still continue to have people that are not taking this seriously. I'm very thankful to those Georgians that we have that have, literally been staying home with their families unless they were going to their place of employment. I had people texting me all over the weekend that are in the construction industry saying, we have implemented social distancing on our job sites. We're doing our part, and I know there's many people that have done that. Grueling decisions by small business owners that I've read about that had to close a pizza restaurant because their customers wouldn't comply with what they were trying to do. So for the good of the public, they shut it down. That had to be a grueling decision for those people. I'm very thankful for the federal support that we've gotten from the president, the vice president, our congressional delegation, with the unanimous support of the Senate stimulus bill. I know that money will begin flowing quickly. That's going to be very helpful to people that have lost their jobs or have limited hours. The SBA loan process, our local banks and many other people, including our team, are working very hard to put that information together to get that in the works very quickly. So I think all of those things are going to help. But as I said earlier, we've been following the data, and I've been following the advice of the task force and the health officials. And there's been all kind of models and different things that we're looking at. But I think this new model that we're following every day, based on guidance on what the president and Dr. Birx and Dr. Fauci said last night, is going to be very helpful for the states as we move forward. Well, I'll let Dr. Toomey speak to that, but we've been doing 2 calls a day, every day, for well over a month. And last night, Dr. Toomey said on that call, and we talked about it again today, that this new information that came from CDC was a game changer. So I'll let her speak to that. Dr. Toomey?
Sure, thank you. I think we knew, you could tell from the pattern of spread, and we knew from the cruise ships that there's likely asymptomatic transmission. CDC guidance and our own testing patterns were to test those with symptoms. And so all of our epidemiologic models were based on people with symptoms. And I think it's a combination not only of recognizing that there's probably a large number of people out there who are infected, who are asymptomatic, who never would have been recognized under our old models, but also seeing the community transmission that we're seeing and recognizing now is the time to stop that transmission before the hospitals get overrun. And this is something that the governor and I and the task force talked about at some length, and I think that the important thing is the action is being taken, and we really need the public's cooperation to ensure that this is valued and also respected. I can tell you that even in my own community, I still have people say to me, I don't understand why you're so upset about this. This is just like the flu. This is absolutely not just like the flu. It's many times more transmissible. It's and it's also much more deadly. And we have absolutely no immunity to this. We don't have a vaccine. We don't have, our bodies were not exposed to this before, so we can't fight this off. So we see, as the pattern of deaths has occurred, those particularly elderly and those with chronic health conditions are most at risk, but everybody is at risk for infection. And I think the time is now to try to stop that community transmission.